Hi everyone, I'm Dorey. I was first diagnosed with breast cancer December of 2020. I was 36 years old with a nearly perfect health history. I was happy and healthy, active, adventurous, all the things that I was hopeful would help ward off disease in my young lifetime. As you know, October is Breast Cancer Awareness Month, so I'm here with my old friend, Dr. Charity Huang, specialist in hematology and medical oncology, to discuss the risks for patients like myself undergoing breast cancer treatment. Hi, Charity.
Hi, Dorey. Thank you for having me. It's so great to see you.
You know, Charity, after my initial diagnosis, I decided to have a double mastectomy. And then even after that, 18 months later, I found another lump. So then I received 38 rounds of radiation daily, which just left my skin burned and painfully raw. And I know that fighting cancer just left my body completely immunocompromised. So during that time, I also had 2 young kids running around during the middle of a global pandemic. There was so much to think about, and I was just facing significant challenges. I was now immunocompromised with an increased vulnerability to viruses like COVID, all while trying just to maintain some sense of normalcy for my family. Fortunately, I was also in the prioritized group for prevention when the vaccines became available. As I move forward, I find myself thinking about my risks, not just for COVID, but all the other diseases too.
I get that. Common treatments for breast cancer, like chemotherapy or radiotherapy like you received, do leave your immune system compromised, and they can increase the risk for other illnesses like COVID-19, RSV, influenza, and shingles.
You can only get shingles if you've had chickenpox, right?
Yes, exactly. It's caused by the same virus, the varicella-zoster virus. When you get chickenpox, the virus develops latency or hangs out in your nerve cells and can later reactivate, causing a very painful rash that lasts 2 to 4 weeks. Cancer radiotherapy may increase the rate of VZV reactivation due to compromised cell-mediated immunity. This reactivation may cause interruptions or prolong the radiotherapeutic course.
I cannot imagine what that would have been like while I was getting radiation treatment.
You know, women are already more vulnerable to shingles, and the incidence of shingles is particularly high in the first year following breast cancer diagnosis.
I had no idea.
Adults on immunosuppressive therapies like radiation can develop more severe, long-lasting rashes compared to immunocompetent patients and are more likely to experience complications from shingles. One of the more common complications is post-herpetic neuralgia, which is nerve pain that can last for months or even years after the rash resolves. While herpes zoster doesn't typically result in hospitalizations, something to consider is that about 30% of those that do end up hospitalized have compromised or suppressed immune systems.
So Charity, what do you recommend for people like me who have undergone treatment or undergoing treatment for breast cancer?
That's a great question. Preventing the reactivation of the virus is the only well-documented means of preventing shingles. The CDC recommends herpes zoster vaccination for the prevention of shingles and related complications in immunocompetent adults aged 50 years or older, and in adults aged 19 years or older who are or will be immunodeficient or immunosuppressed because of disease or therapy.
When I was diagnosed with breast cancer and had to undergo treatment, there were times I was just filled with pure anxiety. You know, it was just up all night going down internet rabbit holes. What else am I at risk for? How can I prevent things? How can I be more cautious?
Dorey, you're not alone in that. Breast cancer, its treatments, and becoming immunocompromised can be really scary.
Yeah, it's a really difficult reality to accept. And then when I hear about conditions like shingles, it just reminds me that I really need to be more proactive about my health and just be grateful that we have modern medicine to help prevent disease. Charity, thank you so much.
Dorey, you are so welcome.